Hi, my name is Melanie and I'm the ER educator, and I'm going to walk you through how to put in a peripheral IV. So the first thing we need to do is get ready and get our supplies. So you need an IV Start kit, you need a flush, you need an extension, and a microclave if your extension doesn't already have one. You're going to need blood tubes for whatever blood draws need to happen for this patient. Remember that a lactic is on ice. It's a gray on ice. So if you need a lactic, make sure you get your ice ahead of time and your gray tube. Now, depending on how much blood you need to draw, it'll depend on how many syringes you need. You need at least, you actually really need 5 if you're doing 2 adult sets of blood cultures plus a lab draw. So make sure you have enough syringes. And make sure you keep those syringes clean as you open them to not contaminate for the blood cultures. And I'll show you how to do that. A transfer device for your blood, and needles. So then when you go to stick your patient, you want to select a vein of your choice, open your IV Start kit. Inside your IV Start kit, you should have a tourniquet and either a swab like this or a swab like this to clean your patient's skin. This is ChloroPrep and this is for Vantix. These are designed, I think that's most of the kits have these, where you squeeze the plastic, you'll hear a crack, and then that liquid will then saturate the pad. So you put your tourniquet on, lift your patient's arm. The goal is 4 to 6 inches above where you intend to stick. So you may not know that when you put this on, but if you need to move it, you can. So for this patient has a nice vein right here. So I'm gonna put my gloves on. Alright. My gloves on, and clean the patient. The entire area starting from where I intend to stick and out. Now remember, when you stick your patient, that you have to wait for the ChloroPrep to dry, because that is when it's working. So if you stick the patient wet, then you've done no good whatsoever. So give this a chance to dry. It should only take 30 seconds or so. I'm not going to wait for this to dry completely on the mannequin because it doesn't dry like skin. So it's going to stay wet for a while. All right, so I'm going to take out my extension and also take out my microclave. And attach the microclave to the end. Now, if you are in the ER, which most of you are, you're gonna leave that open so that we can draw directly from that. We're not gonna flush it yet. We need to open our needle, open our flush, and have these ready to go. We're also gonna open our 10 cc syringes. So in order to keep these clean, if you're gonna draw cultures, keep them inside the sterile packages. I've seen people lay these in here and they're all over the place, or lay them on the bedside table, and all kinds of places where they can get contaminated. See how I almost did that there? All right, I'm just gonna do 2. All right, so this should be dry now. So you're gonna take off the top of your cannula, and then you'll see, I don't know how well you can see that in there, but the bevel should be up and it's on the same side as that button. The button's gonna be the retractor, and this little bump here on plastic is gonna be how you push that cannula in. So when we're looking for, we found our vein over here and cleaned it, bevel up, button up. We're gonna go at a low angle here into the vein until we get a flash. We got a flash. And then we're going to slide the cannula in, push that button, out comes the needle, and then our catheter is there. So these all have a stop valve that makes it so they do not bleed. We're gonna attach our extension. Now when you push this in, the blood will return, and that will never go back to the way it was. So when you remove this again, it will bleed all over the place. So it is now open. I'm gonna slowly draw. If you pull back too hard on this syringe, you will cause hemolysis and inaccurate lab data. So don't be cranking on this. We want to do a slow and steady fill. If it takes a long time or you have a very small vein, change syringes because again, you will have clotting. So remember not to go above 10 cc's if we're going to use this for a blood culture. So if we have our transfer device, we can attach this to our transfer device and we can use this for our lab draw. This is a needle, but your fingers don't go in there. So this is a safe device to use. But remember when you throw it out that it is just sharp. So for our blood cultures, we're gonna fill our anaerobic bottle first. This is the purple. I'm gonna clean it with the Prevantix wipe on the top. And then we're gonna fill this with 8 to 10 cc's of blood. Now you can see that the volume in this bottle is changing. However, the volume that is in all of these bottles is different. So if you're going to fill directly into one of these tubes, you both have to keep it vertical, and then you have to also know exactly where you are to begin so that you know how much you put in and to maintain that 8 to 10. If you go over 10 or less than 8, then you have inaccurate results potentially for your culture bottles. So you're gonna fill your anaerobic bottle first, you're gonna fill your aerobic bottle next. If you have an adult patient, you're gonna have to use a butterfly stick a second time for your second set of cultures. So you will have 4 bottles for an adult patient. If you have a pediatric patient or an extremely difficult stick, you can use 1 PD bottle as your second set of cultures, or you can use 1 bottle if you have a pediatric patient. This bottle only receives 1 to 3 mLs. So don't guess on this. Really, you're gonna have to use a syringe because 1 to 3 is such a small amount. And if you have a great vein, it's gonna overfill the moment you connect it. So that's the PD bottle. So now that we've got our IV in and we've drawn our blood, we need to dress it. So there is a Tegaderm dressing in this kit. We're gonna place over our cannula. And now this is designed to stick this way so that should you have a need to disconnect this here, you still can. You have a view of your site and you can still remove your connection if necessary or tighten it. All right, and this here is designed to mark your time and date. And these come off as well. And the very last thing we're gonna do is flush. So we have a flush. I'm going to clean this just because it touched the table, which is what you should do in real life too. And then we're gonna flush this to clear after we pull our tourniquet. And then we're going to clamp it. And the last thing we're gonna do is tape this piece. So when you are done, you want to tape your pigtail to the arm so that this isn't just flopping all around and that this is stable and secure. And then document as appropriate.